So it's an honor to be back here for the 20th year, and I'm going to try to capture a little bit of the history of the Consumer Network, and I can't cover everything, but hopefully could hit some high points and sort of go into why this network has been so successful. And I would say probably the top 3 largest consumer networks in the country is the Georgia Mental Health Consumer Network. So congratulations on your national leadership. On August 13th, 1992, gas was only $1.13 a gallon. And some 650 of us packed the auditorium at Mercer College in Macon. A volunteer staff and board of directors delivered the first Georgia Mental Health Consumer Network conference. Well, history was made as the network birthed a grassroots organization with the purpose, as stated in the bylaws, to enroll Georgia residents into a network that will speak as a unified voice intended to help empower consumers to reach their potential of life, liberty, and the pursuit of happiness. Those bylaws went on to say that the new nonprofit would hold an annual statewide consumer convention where the membership will democratically determine the top 5 consumer priorities. And that's what we're going to do again today after Joel's presentation. Yes. I think that vision of your founders, that we would come together and unite around what the membership wanted for us to work on every year, was the moral foundation that has led to the huge success of this network. I have seen organizations get pulled apart over power struggles. But from day one, it was the vision that we would bring together the people experiencing what it's like to live in recovery from mental illness and addiction. And we would let them speak, and we would put aside our own issues to unite to promote what they wanted as their top priorities. I think that was the key to what has us here for 20 years. And I want to acknowledge that great vision of leadership of the founders. You have some 4,000 members. You have nearly 50 staff. 50 staff! And a national reputation for innovation and leadership. It was founded on the concept of service to others, which I believe is a spiritual concept, and uniting to build positive outcomes with a can-do attitude. I just want to take you for a minute into the impact that this organization has had on the country. You pioneered the certified peer specialist workforce, expanding across the country and now covered by Medicaid reimbursement in more than half the states. In the next 5 years, it will be all 50 states. The Peer Specialist Program is a great example of how the Consumer Network drove true transformation with a unified voice. At our first conference, and for many subsequent conferences, The top priority elected by the conference attendees was employment. Employment. People wanted something meaningful to do. At that time, the system thought the answer was medication and more doctors. And we kept saying, you know what? You're sort of out of touch with reality there. What a human being needs is meaning and purpose. And that's what we need more of. And so that priority led to 10 years ago when the governor of our state, then Roy Barnes, said we're going to change all the services in Georgia and we're going to move from the clinic option, where you had to go to a clinic to get your services, to the rehabilitation option of Medicaid, to where you could take services out and focus more on people's strengths rather than their medical necessity. When that opportunity came, because of your voice, Georgia put peer support in as a new service. It cleared the state level. Medicaid has to approve our services, so that it passed the state level. And then it went to Baltimore, where the headquarters are for the Center for Medicare and Medicaid Services. And they called up and they said, what in the world is this thing called peer support? Where is the evidence behind it? Now, we got lucky because that year, 1999, the Surgeon General of the United States had come out with the first report ever under the Clinton administration done on mental health by a Surgeon General. And a group of consumers involved with shaping that report had gotten peer support into the Surgeon General's report as an evidence-based practice. So that federal document backed us up. And so it was really your voice that made history in this country, and you advocating for a top priority of people going to work. And I understand, and Mark Baker's here. Mark, I hope I'm not going to cross into territory I shouldn't. I understand that the state of Georgia is planning on increasing the certified peer specialist workforce to 3,000 people. Folks, that is an incredible goal. It's not going to be easy. Sherry, is it going to be easy? It's not going to be easy. But it speaks to the success of what you created here and your ability to unite, put our differences aside, and speak for everyone and agree on a common vision. And that's what makes this network work. I want to look at one other thing that you have lined up. You are ready for something huge happening in our country right now. Now, don't hold this against me, but I now have a job in Washington, D.C. Please don't hold that against me. And you know what? If there's a group of folks that ever needed an intervention, it's the government in Washington, D.C. And talk about a need for anger management. Oh, man. Here's what's happening. And this is the law of the land right now is health care reform. We don't know what's going to happen to it. The fight is ugly. Who knows how it's going to turn out? But right now, the law of the land is healthcare reform. And folks, built into that reform, for the first time in this country, are billions of dollars for a thing called prevention. Prevention. Now, to show you how serious this is, for the first time in the history of this country, the Substance Abuse and Mental Health Services Administration, called SAMHSA, and HRSA, Health Resources Services Administration, which is your public mental health. So your public mental health and addiction, or substance use disorders, and your public health have come together for a $100 million grant for 4 years to figure out how to integrate your health and our mental health and our addiction, putting them together. And so in my role as Deputy Director for this new center, I can tell you that the plan is that we're going to put the head back on the body. That we're going to look at the whole person in recovery. You are ahead of everyone with your peer support and wellness respite centers. You now have 3. That's the most of any state. Keeping people out of hospitals. Prevention. Keeping people, focusing on staying well, focusing on their strengths. Prevention. You are already there. Last year, your conference was on resiliency. Now, we used to think of resiliency as bouncing back, but where you're going is the idea that there are these mind-body resiliency factors that can lead to prevention, that can keep us from relapsing, that can keep us whole and well, and keep us out of hospitals based on resiliency factors like peer support. Folks, that is a resiliency factor. We as humans need each other. And now the science is showing, they call it a social network. We've been knowing it for years. Service to others. We've been knowing for years. I've got 26 years clean and sober. When you give it away, you strengthen your own recovery. We've been knowing that for years. And finally, the people in Washington are saying, oh my gosh, there's evidence behind peer support and service to others. Thank you for waking up. And so I want to end this with just going to a quote from one of my heroes, Dr. Martin Luther King. He saw an evolved community, a spiritual community that we need to get to somehow. And he said, we are all woven into a mutual garment of destiny. I am not all I can be until you are all you can be. You are not all you can be until I am all I can be. That's the Georgia Mental Health Consumer Network is. It is Dr. King's vision of an evolved community where we are supporting each other. We are loving each other. We are calling forth the potential in each other. That's who you are. And Dr. King was talking about this sort of community. Thank you for your 20 years of unbelievable leadership. Thank you.